Farxiga, dapagliflozin uses in type 2 diabetes, heart failure, and chronic kidney disease. What is Farxiga, dapagliflozin? Farxiga, the brand name for dapagliflozin, is an oral prescription medication primarily used to help manage type 2 diabetes in individuals aged 10 years and older. When combined with a healthy diet and regular physical activity, Farxiga significantly reduces blood glucose levels. In addition to its role in blood sugar control, Farxiga is FDA approved for reducing the risk of hospitalization and mortality in adults with heart failure or chronic kidney disease, CKD, even in those without diabetes. Farxiga belongs to a class of drugs known as sodium glucose cotransporter 2, SGLT2, inhibitors, which work by targeting specific transport proteins in the kidneys. This once-daily medication is generally well tolerated, although common side effects may include genital yeast infections, increased urination, and weight loss. Clinical uses of Farxiga, dapagliflozin. Farxiga, dapagliflozin, is prescribed for the following conditions. Type 2 diabetes mellitus, used alongside diet and exercise to improve glycemic control in patients aged 10 years and above. Heart failure in adults, reduces the risk of cardiovascular death and hospitalization in individuals with heart failure and coexisting type 2 diabetes or other heart conditions. Chronic kidney disease, CKD, lowers the risk of kidney function decline, heart failure-related hospitalization, and cardiovascular death in adults with CKD, regardless of diabetes status. How Farxiga, dapagliflozin, works. Farxiga acts by inhibiting the SGLT2 protein in the kidneys, which normally helps the body reabsorb glucose and sodium from urine back into the bloodstream. By blocking this process, Farxiga offers specific benefits based on the condition being treated. For type 2 diabetes, prevents reabsorption of excess glucose, allowing sugar to be excreted in urine. This directly helps lower elevated blood sugar levels. For heart failure, inhibits sodium reabsorption, reducing fluid overload and easing the heart's workload. This improves cardiac function and reduces hospital admissions. For chronic kidney disease, enhances blood flow through the kidneys, decreases pressure within the glomeruli, and helps delay the progression of kidney damage. Common and serious side effects of Farxiga, dapagliflozin. While Farxiga, dapagliflozin, is generally well tolerated, like all medications, it can cause side effects. These vary in frequency and severity, depending on the individual's health status and any concurrent medications. Common side effects. Reported in clinical studies, the following adverse effects occurred most frequently. Vaginal yeast infections in females, affects approximately 7 to 8% of users. Upper respiratory tract infections, includes nose and throat infections, seen in 6 to 7% of patients. Urinary tract infections, UTIs, occur in about 4 to 6% of those taking Farxiga. Other reported side effects. Some individuals may also experience back pain, muscle or joint pain in the arms, legs, hands, or feet, increased urination, discomfort during urination, genital yeast infections in males, nausea or constipation, flu-like symptoms, elevated cholesterol levels. Serious side effects, seek immediate medical attention. In rare cases, Farxiga may lead to serious health concerns. Contact your healthcare provider or emergency services if any of the following occur. Diabetic ketoacidosis, DKA. Symptoms may include fruity-smelling breath, excessive thirst, dry mouth, nausea, vomiting, stomach pain, fatigue, or difficulty breathing. Severe allergic reactions. Watch for swelling of the face, lips, tongue, or throat, rash, or trouble breathing. Prompt medical attention is essential if these symptoms develop, as these reactions can be life-threatening if not treated early. Pros and cons of Farxiga, dapagliflozin. Benefits. Convenient once-daily dosing. Simplifies treatment routines for patients. Low risk of hypoglycemia. When used alone without insulin or sulfonylureas, Farxiga is unlikely to cause dangerously low blood sugar levels. Compatible with other treatments. Can be used alongside other medications for diabetes, heart failure, or chronic kidney disease, offering flexibility in treatment plans. Pose. Increased risk of infections, particularly genital yeast infections and UTIs, which can be recurrent in some individuals. Not available in liquid form, may limit use in patients who have difficulty swallowing tablets. Pregnancy limitations. Farxiga is not recommended during the second and third trimesters due to potential risks to the developing fetus. Pharmacist tips for safely using Farxiga, Dapagliflozin. To get the most benefit from Farxiga, Dapagliflozin, while minimizing potential risks, it's important to follow these key guidelines from pharmacists and healthcare professionals. 1. Daily use and dosing. Take Farxiga by mouth once daily, with or without food. Try to take it at the same time each day to maintain consistent blood levels and effectiveness. 2. Stay well hydrated. Farxiga can increase urination and may lead to dehydration or a drop in blood pressure. Be sure to drink plenty of fluids throughout the day. If you experience dizziness, lightheadedness, or weakness, especially when standing, contact your healthcare provider. 3. Monitor for genital and urinary tract infections. Farxiga raises the risk of genital yeast infections and urinary tract infections, UTIs. Let your care team know right away if you experience any of the following: pain, swelling, redness, or tenderness in the genital area, unusual odor, itching, or discomfort, blood in your urine or burning pain while urinating, frequent or urgent urination. These could be signs of an infection that requires treatment. 4. Watch for signs of ketoacidosis. Although rare, ketoacidosis is a serious complication that can occur even if your blood sugar isn't very high. Seek immediate medical attention if you develop fruity-smelling breath, nausea or vomiting, trouble breathing, fatigue or general malaise. If you have type 2 diabetes and are using Farxiga, your care team may recommend checking your ketone levels, especially during illness or fasting. 5. Recognize and respond to low blood sugar. While Farxiga alone has a low risk of causing hypoglycemia, the risk increases if it's combined with insulin or other diabetes medications. Symptoms of low blood sugar, under 70 mg per deciliter, include shakiness, confusion, rapid heartbeat. Know how to correct low blood sugar quickly with glucose tablets or fast-acting carbs, and when to call emergency services. 6. Alert your provider before surgery. If you are scheduled for major surgery or anticipate not eating for a period, inform your prescriber. Fasting and physical stress can raise your risk for ketoacidosis. Your provider may advise you to stop taking Farxiga temporarily and restart once you are fully recovered and eating normally. 7. Maintain a healthy lifestyle. Continue following a balanced diet, engaging in regular physical activity, and adhering to your prescribed medication regimen. Farxiga works best as part of a comprehensive management plan for type 2 diabetes, heart failure, or chronic kidney disease. 8. Pregnancy and breastfeeding considerations. Farxiga is not recommended during the second and third trimesters of pregnancy or while breastfeeding, due to the potential risk of harm to the baby's kidneys. Speak to your healthcare provider about alternative treatment options if you are pregnant or planning to become pregnant. Farxiga, Dapagliflozin, offers substantial benefits for individuals managing type 2 diabetes, heart failure, and chronic kidney disease, but it must be taken responsibly. Always follow your healthcare provider's guidance and consult your pharmacist for medication-specific concerns. If you found this video helpful, don't forget to subscribe to HeInfo for expert-backed videos on diabetes, kidney health, heart conditions, and medications explained in plain language. Like and share this video to help others learn more about Farxiga and its safe use. Drop a comment below if you have any questions or experiences with Farxiga you'd like to share. We respond to every question. Watch our next video where we compare Farxiga with other SGLT2 inhibitors to help you understand your treatment options better. Thanks for watching HeInfo, where your health is our priority.